Hi, my name's Pam Underdown and I'm here for the Body Tite procedure with Dr. Ian Strawford. So Body Tite, what I'm having basically is my top and sort of lower abdomen with a minimally invasive radio frequency assisted liposuction to actually contour and help remove some of the fat and tighten up the skin. So yeah, that's the procedure I'm having. Get ready for the wedding next year.
BodyTite has been used for many years now, but the new advances in technology mean that we can even more safely deliver radio frequency energy during a BodyTite treatment to really more effectively remove fat, allow contouring of the body, and more importantly, to get skin tightening following the procedure when the fat's been removed.
Good morning, Pam.
Morning.
It's lovely to see you again.
And
your
you.
day of treatment has come.
Yes.
How are you feeling about it all?
Yeah, okay, a little bit nervous, but yeah, fine,
Sure.
yeah.
Ready to go anyway?
Ready to go, definitely ready.
Fantastic. Well, look, I'm going to go through the consent procedure with you.
Okay.
You've consented for the procedure. I know we've had a chat about it and I've explained it all in detail before, but
Yeah.
I'll just go through it with you again, just the details of what we're going to be doing today.
Okay.
And then what to expect and what to do afterwards, obviously.
Yeah.
Okay.
Yeah.
Where we have fat underneath the skin, and this is stubborn fat that often people can't lose through diet and exercise, they may have pockets of fat giving either a sort of a belly that they don't want, a sort of a roll of fat that hangs above the belt line, or it might be fat overlying the hips, the lateral thighs, perhaps down in the inner thighs and the legs. There are often areas of fat that really are very stubborn. Even with weight loss and regular gym, it doesn't seem to shift. So this is an ideal body contouring procedure. Liposuction has been around for decades, and traditionally liposuction has been done in hospital under a general anesthetic, and it involves the surgeon having to very forcefully try to aspirate or suck out the fat from the area that's being treated. One has to look at the structure of fat. Fat is not, as people think, maybe just like a pack of butter underneath the skin. It's actually a fibrous network, almost like a scaffolding, like a honeycomb underneath within the fat, and within that are fat cells. This fibrous or collagen network around the fat cells makes it very difficult and sometimes traumatic to remove the fat through a typical traditional liposuction. So with BodyTite, we're using the radio frequency energy to literally break those fibrous connections down that are all holding the fat together. This is called the fibrous septal network. Once the fibrous septal network is broken down by the BodyTite, then it's very easy to aspirate the fat and remove that fat in a much more gentle and less traumatic way. Equally and importantly, because we've broken the fibrous network down, there is a remodeling of the fibrous network following the procedure. So over the next weeks and months following the treatment, the skin will retract back from where the fat's been removed to give a much smoother, tighter result. Certainly significantly more reduction in skin laxity compared to any other treatment.
Oh yeah.
Great.
I'll just keep my eyes shut.
Hey.
I'll keep my eyes closed. Mind you, I can't see anything anyway, can I?
So Pam, what I'm going to do next is just a little bit of local anaesthetic just in the skin.
Yeah.
A little bit stingy, just so where I'm going to start going in. All right, so it'll be a little bit stingy. Yeah, I'm going to be putting in about 1.5 to 2 litres of fluid and anaesthetic into that fat space. You're going to feel very bloated by the end of that, but very numb. Okay.
So with BodyTite procedure at the start, we introduce a volume of anaesthesia This is known as Klein solution, and it's a solution of sterile salt water with high concentrations of local anesthetic. This takes about half an hour to get this fluid into the fat space that we're going to treat, but it does give us a very safe medium in which to heat up the fat with the BodyTite, but also gives an anaesthesia, so most patients feel really nothing during the procedure itself.
This is, you can barely feel it. It's just a bit odd, really.
So on camera, when you see the video, you'll probably think, oh my God.
Yeah. You can barely feel it. There is a tiny bit strange feeling, but that's kind of it.
The procedure itself, to remove the fat and to heat the tissues, takes around about an hour. And during that time, we'll be aspirating the fat. And at the end of the procedure, one can often see a significant volume of fat that we removed. Often between 1 and 2 litres of fat is quite normal from one of these procedures. The results from BodyTite can take between 6 and 9 months to achieve the full benefit. You'll see the initial reduction in volume because we've removed the fat, but the skin tightening and retraction of the skin over that treated area to give the final smooth result is best seen at about 6 to 9 months, but it can even take a year to get to the final result. The results from BodyTite are long-lasting. We've permanently removed the fat and we've tightened the skin and the fibrous network. So following the procedure, as long as you look after yourself, you don't let yourself go, you maintain a very healthy diet, plenty of exercise, then the results should be long-term. The common areas that we use BodyTite is anywhere where there is an excess of fat that is beneath the skin. And so the common areas are usually the abdomen. That's probably the most important area for a lot of people, perhaps the flanks in ladies. It can treat men who have a condition where fat is deposited under the skin in the breasts, often called boobies, but if it is fat that's there, that can be removed and improves the male chest. But any area where there's excess fat, so it's not uncommon that we'll do the inner thighs or the outer thighs, perhaps around the knees, in the arms, in the face and neck we can also use a similar procedure. But anywhere where we want to remove fat and get an element of skin tightening, then BodyTite is a good procedure. It's not a procedure for people who've got significant obesity. You're not going to lose weight through the procedure. And we encourage patients, if they are overweight, that really they need to sort of sort that out and go on a diet, lose weight, get some regular exercise, and then perhaps following that we can consider whether a body contouring procedure such as BodyTite is appropriate. At the end of the procedure, you'll be fitted with a compression garment. This is an elasticated undergarment which compresses the area that we've treated. This is a very important part of the procedure because obviously we've removed a volume of fat. That does leave a space. We want to compress that space down, so when the collagen remodeling happens within the fat fibrous network, it happens in a compressed way, so therefore the skin will retract back and we'll get a nicer, smoother, firmer result. The advice we give with regards to the compression garment is that you wear it for at least 23 hours out of 24 hours every day for the next 3 weeks following your procedure. It's very important that we don't allow fluid to collect in that treated space, and if you wear the garment, that is very, very unlikely to happen. Following this, we like you to wear the garment for another 3 weeks if possible, wearing it at least 12 hours a day. So in summary, the advantages of BodyTite over traditional liposuction is that it's a procedure that can be done out of hospital under a local anaesthetic as a day procedure where you go home the same day. The recovery is very quick. Most people are back to work and normal activities within a day or so. The results also are improved because we get a significant skin tightening, and this is something that you don't usually see with traditional manual liposuction. So we often get a retraction of the skin, a smoother effect from the area that's treated. and overall patients are very satisfied with the procedure.
I've just had the BodyTite procedure with Dr. Ian Strawford at Refresh in Plymouth, and so a little bit swollen, so it's a bit tender at the moment, but the procedure went well. Can you believe we actually got 1.7 litres of fat out? So we've got some videos and some pictures of those to show you, but anyway, it's, yeah, a little bit swollen, a little bit sore, so I should be wearing the compression for the next 6 weeks, 3 weeks, 23 hours a day, and then 12 hours a day after that. So just got to take it easy for the next 24 hours. But to be honest, I'll be back at work tomorrow. That's all quite normal. And then I can carry on with my swimming and everything next week and go back to the gym Wednesday. It's fine. So yeah, Ian looked after me, Dr. Strawford looked after me very well.